Here are some facts regarding colonoscopy and colon health. According to the Centers for Disease Control and Prevention, CDC, colon cancer is the second largest cause of cancer-related deaths in the United States. This is why it is essential to conduct testing for the prevention of such type of cancer. According to the Surveillance Epidemiology and End Results (SEER) program of the National Cancer Institute, over 50,000 individuals are expected to die from colon cancer in 2017. If you have any signs of the condition, you should see a doctor immediately. Continue watching to learn more about colonoscopies, colon cancer, and what you need to discuss with your doctor before a colonoscopy. Let us first discuss the various kinds of colon cancer screening alternatives. Colon cancer screening. There are several colon cancer screening and preventive techniques available. While a colonoscopy is the most extensive examination, the U.S. Preventive Task Force suggests that persons who are not at high risk for illness wait until they are 50 years old to begin regular screening. According to a study conducted by Kristen Sheffield, an associate professor of surgery at the University of Texas, over 30% of colonoscopies conducted in Texas through Medicare claims were likely unsuitable to screening recommendations. Other screening strategies for colon cancer prevention have included a fecal occult blood test and flexible sigmoidoscopy. According to the University of Texas, doing a colonoscopy on individuals would be inappropriate on the screening standards, exposing them to colonoscopy risks without proof that it will help them. Colonoscopy side effects. Based on the Canadian Cancer Society, possible risks of colonoscopy include tiny amounts of blood present in the stool for 1 to couple of days. If a biopsy was performed and/or a polyp was removed, nausea, vomiting, bloating, or irritation of the rectum as a result of stimulants used to cleanse the colon and air that used to inflate it. If your doctor does not immediately recommend a colonoscopy, they may suggest a sigmoidoscopy, which is similar to a colonoscopy. They both use a thin flexible tube with a camera at the end to examine the colon, but the sigmoidoscopy can only reach the lower third of the colon, whereas a colonoscopy can examine the entire colon. If a doctor notices blood in a patient's stool, they would usually suggest a sigmoidoscopy or colonoscopy to investigate the cause. Uncommon but serious colonoscopy complications. In accordance with Canadian Cancer Society, unusual but significant consequences of colonoscopy include intestinal perforation, excessive bleeding, or an allergic response to the sedation drug. Are unnecessary colonoscopies harmful? Based on the University of Texas study stated previously in this video, no unnecessary colonoscopies are harmful to patients. They simply provide no benefit and are a waste of costly hospital resources and effort. What else should you discuss with your doctor if you're scheduled for a colonoscopy? The Canadian Cancer Society recommends that you ask as many questions as possible about what you should prepare. You should ask about the operation, how long it will take, and what you need to prepare. You should also ask what you should and should not consume before the operation. If you're having a colonoscopy, your doctor will tell you what you should do to prepare. According to the Canadian Cancer Society, you should probably skip breakfast and dinner before the operation. They may also advise consuming 2 to 4 liters of drink containing laxatives and electrolytes. Now, since you understand something about colonoscopies, here are some suggestions for removing waste from your colon. 1. Detox. Aside from ingesting healthy bacteria and probiotics like yogurt, kefir, and kombucha, you can also cleanse. This detox is a strategy for determining which meals cause intestinal problems. Foods are usually severely restricted, and then gradually put back one at a time to establish the reason of the digestive problem. For example, if you feel that seafood is causing your digestive problems, exclude it from your meals for a week. If no problems emerge throughout that week, perhaps introduce one specific type of seafood after a few days. Continue to add other varieties of seafood until you can determine which item is causing these stomach issues. 2. Juice cleanse. A juice cleanse is yet another successful way. Just warm a glass of water, then add salt and toss in some apple juice, ginger juice, and fresh lemon juice. Drink this mixture on an empty stomach early in the morning, and then again shortly before a light meal. It should be consumed once more in the afternoon. Before starting on any cleanses or detoxes, ensure that you are well hydrated on a regular basis and also that your meals have a healthy balance of fats, proteins, and carbohydrates, as well as fiber. The colon is an important organ of the human body since it not just processes food and releases waste, but it also guarantees that all poisons, chemicals, and harmful bacteria are removed from the body. Furthermore, they guarantee that the body absorbs the vital elements and vitamins included in diets. If the digestive system or colon isn't working properly, it can cause a number of negative consequences in the human body. These harmful poisons will not be absorbed by the body and will consequently stay in place inside the stomach. Bloating and gas are some indicators that your colon isn't performing adequately and efficiently. Diarrhea, indigestion, frequent and loose feces, and exhaustion bowel motions that are inconsistent or fewer than one poop per day. If you experience more than one of these symptoms, it might be an indicator of colon or digestive disorders. Thus, if you are planning for a colonoscopy, consider some of the information in this video. According to the Canadian Cancer Society, most colonoscopies take around 30 to 45 minutes to do, although they can occasionally take a little longer since the patient is observed for 1 to 2 hours following the test. Despite research suggesting that colonoscopies are not always necessary, they remain the most reliable procedure for doctors to screen for colon cancer. Have you experienced colonoscopy? Any tips for those who will undergo colonoscopy? Comment down below. Give this video a huge thumbs up. Subscribe to the channel if you want more health and wellness tips. And hit the notification bell to get notified every time I post a new video. Thank you for watching.